Hello and namaste. Welcome to the COVID Care series presented by Apollo Hospitals. How are you all? I hope you've all been well and safe and taking all the precautions to protect yourself and your loved ones from COVID-19. One thing that many of us have lost ever since this pandemic started is a good night's and restful sleep. There is even a word coined now. I don't know how scientific it is. It's called coronasomnia, referring to the sleep problems that arise due to the COVID-19 pandemic. There are a host of reasons for this to happen, and I'm sure you know all of them, but there's just no way that we seem to be able to get a good night's sleep. Change of our routines, which can be because of working from home or staying at home, quarantines, school closures, they can all interfere with our sleep time and change our routine and our sleep-wake cycle. There may be anxiety and worry about the pandemic, whether we would get it or our loved ones would get it, where could we go to get treated, would there be enough medicines and oxygen, or what do you do if my job goes, or will I have a salary cut, economic reasons, or exam tensions. All this can lead to anxiety, and a racing mind can definitely keep you tossing and turning at night. Of course, this pandemic can also trigger loneliness, isolation, depression, and even grief when there is a loss of a loved one. And of course, we spend a lot of time on the screen. We are all the time connecting with people, looking at news on the mobile phone, binge watching TV, and all this again adds up to our total screen time and may affect sleep. And of course, all the tension of managing a home and kids who are stuck at home for months on end and are restless can cause irritability and discord and stress, and everything points to the direction of a disrupted sleep. Sleep, though, is very critical to our physical health and our immunity, and is one of the most challenging things. It's not easy, and it's something that we have to learn how to get a good night's sleep and what is sleep hygiene. And for this, and to explain this to us, discuss all the issues of sleep during this COVID-19 pandemic and how to manage sleep disorders, I am delighted to welcome Dr. N Ramakrishnan, who is the director of our critical care services at Apollo Hospitals, Chennai. Dr. N Ramakrishnan is an American board certified specialist in internal medicine, critical care medicine, and sleep medicine, and also has a master's degree in medical management from the University of Southern California. He's currently the Director of Critical Care Services at Apollo Hospitals and a Senior Consultant in Critical Care and Sleep Medicine. Dr. Ramakrishnan graduated from the Stanley Medical College, Chennai, and subsequently worked in the UK and the US for over 13 years. He has been instrumental in developing the Chennai Critical Care Consultants, a private practice group of critical care specialists who are specialized on innovative tele-ICU services, and also has successfully established the TACT Academy for Clinical Training, which is India's first simulation-based healthcare training center. Dr. Ramakrishnan is the first board-certified sleep specialist practicing in India, and is also the president of the Indian Sleep Disorders Association. So I can think of no other better person to actually guide us on how we can all sleep better, avoid that midnight munchies and all those things, and how to avoid the sleepless nights. Hello, Dr. Ramakrishnan, and welcome to our COVID Care series. And we all are really looking forward to understanding how we can all sleep better.
Good afternoon, and thank you, Dr. Srinidhi and Apollo Hospitals, for having me on this Facebook Live series. Today, wherever we turn, whatever we see, the only thing we hear about is COVID-19, the coronavirus disease, which is an infectious disease, which is a contagious disease. But the World Health Organization, prior to this pandemic, has been enormously focusing on the non-communicable diseases, which are really causing more deaths, of course, barring this COVID pandemic time. In general, the non-communicable diseases have been greatly responsible for morbidities and death. And when we think about non-communicable diseases, We often think about high blood pressure, diabetes, heart disease, cerebrovascular disease or stroke, obesity, but we forget that more common than several of these is actually sleep disorders. And sleep disorders can even lead to some of the problems that I was just mentioning, including heart diseases, which I forgot to mention in my initial list. So I really think that people need to be more aware of the importance of sleep at all times and address their sleep problems early so that you can prevent a lot of these complications. Today, when we are dealing with this pandemic, what we are seeing as sleep specialists is those who have previously had sleep problems seem to have a worsening of their problems. And those who don't have sleep problems are now developing sleep problems. So there is an increase in the number of people who are actually presenting with sleep problems. And as a sleep specialist, in general, what we commonly see are those who are unable to sleep, which is insomnia, which is what we would focus on predominantly today. We also see a lot of people who are excessively sleepy, feeling sleepy all the time, those who are snoring, those who have obstructive sleep apnea. So that's another common problem that we encounter. We also encounter a lot of people having circadian rhythm disturbances, those who can't sleep on time, those who can't wake up on time. It may be related to shift work. It may be related to something with their internal clock that doesn't allow them to sleep on time. And also those who have fragmented sleep. They go to bed on time, they wake up on time, but they wake up several times in between due to whatever reason, often related to some other medical problems. And not to forget parasomnias, where people present with abnormal problems during sleep, like they may be sleepwalking, sleep talking, sleep eating, any of those could happen. And those are also the sleep problems that we see. So to focus on what we are going to talk about today, as I said, during the COVID pandemic, there certainly has been an increase in the number of people with sleep problems. And in fact, we have looked into this in detail, and we presented something called lockdown sleep syndrome, which we are seeing very, very commonly in people with, during the COVID pandemic, particularly after the lockdown. Now, this seems to be related to, number one, lifestyle changes, which you already mentioned. Working from home certainly not like, getting out, traveling, getting to your workplace, meeting people. All that becomes very different when you start working from home. In fact, people don't even stick to a schedule when they are working from home. They work in between and then they take a break. They work longer hours, in fact, some of them, because they're trying to catch up. So certainly a change in the lifestyle seems to be one of the major factors that could be affecting sleep. The second thing is not getting enough sunlight exposure. The body in general, when we expose our body to sunlight in the morning, we synthesize vitamin D, but it also seems to impact our melatonin production at night. So those who are vitamin D deficient can also be melatonin deficient at night, and therefore may have trouble sleeping on time. They may start sleeping very late or not sleep at all. So certainly not getting enough sunlight is another contributing factor. The third thing, as you already mentioned, is fear and concern, anxiety about COVID. As you said, will I get it? Will somebody near me get it? I heard somebody who's very close to me who passed away because of COVID or is having severe COVID disease and is getting hospitalized. So you hear all the time about COVID and the related problems, and it certainly seems to have an impact on the mind of people, affecting their sleep. And not to forget, lastly, general fear and anxiety and uncertainty about the future. How long will this go on? How long will the lockdown be? When will I resume work? Is this going to impact me financially? How is my business going to do in the long run? Like so many other thoughts that come with this. So these seem to be the top 4 reasons why the sleep seems to be affected. Of course, in no particular order, and not that all 4 should be present on anyone. So any of these factors could be contributing to people who are having trouble sleeping. Very, very rarely, and literally I'm talking about 1 or 2 people, I have seen people post-COVID, after the infection, having severe, what we call hypersomnolence. They're sleepy all the time, almost presenting like narcolepsy after the viral syndrome. So that's extremely rare. So we will focus on the insomnia and lack of sleep during the COVID pandemic. I really want to stress on the fact that a good night's sleep with modification of what you're doing, you don't necessarily need medications all the time. Modification of how you follow the sleep hygiene would certainly make a difference. And since you mentioned about immunity, I want to close with what I'm talking about by saying that if someone is not getting enough sleep, if they are sleep deprived, their immunity could be affected, which means they are more prone to illness. But more importantly, it may even impact how the vaccine is effective for them. So having a good night's sleep is absolutely essential. I will stop there, but I'm happy to take any questions.
Absolutely. So does the COVID viral infection itself, apart from the fact that you spoke about excessive sleeping, does that person gets infected, even mild, moderate, do they have sleep problems too caused by the infection itself?
Absolutely. Actually, any viral infection, any bacterial infection per se can disturb sleep because there are a lot of, humoral or hormonal changes that happen in the body. The cytokine release, all of those. Just fever by itself can impact sleep. Some people, in fact, can even develop what we call delirium during the viral illness or any kind of illness. They may be confused, they may be unable to sleep, they may be very restless during sleep. All of this is some kind of a mental clouding. You can call it different names. You can call it encephalopathy, delirium. But there are some changes that happen related to any infection that can lead to sleeplessness or disturbed sleep. Their sleep may be very fragmented. And all the more, like they may also have a tendency to sleep in the afternoon. So if you count the number of hours they sleep, it may overall be okay, but it's not continuous at night. They sleep for a few hours in the daytime and then, try to sleep during the night. And that is possible.
So what is, what is the, how do we all, like, when there are all these factors around us which we cannot change, how do we then sleep better? What are the most important ways to have that sleep hygiene and sleep better?
Yeah. The number one thing is having a regular schedule, whether it is sleep or activity, having a regular schedule, because in a way it's a learned behavior. Like there are people who exactly sleep on time and wake up on time. And that includes me, like I want to sleep by 10:30. I do wake up at 5 or 5:30, irrespective of whether it is a Sunday or a holiday, which is not particularly great, but that's my cycle and that's how I'd like to do it. So having a schedule is absolutely important. And same not only with sleep, but also during the daytime, particularly when you're working from home, having a dedicated space, thinking of it as work hours, and during that time, behave like how you would be at work so that you're not, intermittently coming out and having family interactions. Have the dedicated time for work. And when you are done with work, have dedicated time for unwinding with your family. Like make sure that there are some relaxing moments before you actually go to bed at night. And the reason I'm specifically saying that is, unfortunately, if you turn on the TV, again, you're hearing about news that you really do not want to hear. Social media, like there's a lot of good information, but there's also a lot of bad information out there. And, and that can actually make people more anxious. So having protected time where you're not looking into any of these, trying to do even mindless activity, playing, washing dishes or whatever it is, like doing certain other activities to unwind would certainly make a difference. So number one, I would say, is the schedule. Number two, like just because we are inside the house does not mean that we cannot be active. You still need to do some routine, whether it is stretching exercises, yoga, or whether it is, walking upstairs in your terrace or around the house, where you are still following the regulations and guidelines. I'm not telling you to break that and go out and walk around in a park or somewhere, but certainly, like increasing your activity inside the house would certainly make a difference. Getting some sunlight exposure in the morning, once again, by going to the terrace or sitting in a balcony or any of those would improve the cycle of the vitamin D and the melatonin. Avoiding coffee, tea, any kind of stimulants, at least about 4 to 5 hours before bedtime would certainly do well. Smoking, alcohol, the same way, like more at home doesn't mean that, alcohol consumption should increase. So certainly cutting down on all of those would certainly make a difference. But if I had to stress on one thing, I would say have a regular schedule, avoid unnecessary stimulants, make sure that you do both regular activities in the daytime and at night.
What about, one way many people unwind is by, may not necessarily be the news, but they watch something else on television or on their iPads. So is that going to be also detrimental to them falling asleep?
See, too much of screen time, at least close to bedtime, and particularly if it is very close to your eyes, can stimulate what we call the rods and cones in your eyes, and can once again impact the melatonin secretion negatively. So it is not advisable to have much of screen time at night. We always say that like at least an hour before, make sure that you're not exposed to screen time. But more importantly, I would say that avoid any kind of laptop, phones, or like watching TV while in bed, because this is a mental association factor. I always tell people, if I gave you a toothbrush, or if I let me give you another example, if you give a pen, like you would either write with it or you would like keep it safely, but you wouldn't bite and eat it. So similarly, when you see the bed is meant for sleep or intimacy with your partner and nothing else, and therefore lying down in bed and watching TV or reading or any of those can negatively start impacting your thoughts on sleep and how you're going to achieve it.
Is it possible for any temporary sleep problems that occur during the pandemic, can they develop into a chronic problem?
I think that's a very valid thing. And this again, when people have insomnia or lack of sleep due to any reason, addressing it early is very important. If it is persisting for more than 2 weeks, then it is important to talk to a doctor and make sure that it is addressed. And the reason why that is important is when people have lack of sleep over a period of time, it actually leads to what we call psychophysiological insomnia, where what happens is when they start going to bed, they start worrying, they get bed anxiety, saying, will I sleep? Will I not sleep tonight? And that bed anxiety has a much more negative impact, and therefore their sleep is even worse. So we need to break that cycle and make sure that they're not getting anxious about the sleep, however we treat it, like whether it is just counseling or a brief course of a medication, depending on what it is, or if they have other underlying medical problems, addressing that certainly would make a difference, because the longer you leave without treating it, it can definitely lead to bed anxiety and a negative impact. I also want to take this opportunity to specifically say one more thing, that people at this stage often resort to over-the-counter medications. They go and take medications themselves. They start taking cough syrup, saying that it will help me with sleep. Remember, a cough syrup is for cough and not for sleep. It may be a side effect, but it is certainly not the main effect for which it is given. So we should not be taking any of those. And often, sometimes people say, oh, my parents were taking this, so I just took this tablet sometime. Taking medications without prescription will further lead to what we call tolerance to medications, because the medication may not be effective for them after a period of time, and it can certainly lead to dependence on the medication as well. So if you have an issue, it is better to talk to the doctors early and follow the advice, and if necessary, take the medication, but wean off as suggested by the doctor.
What about other medications that a person may be on? Do they affect sleep, or is it better to consult a doctor if there are sleep issues and tell them what medications that you may be on that might interfere with sleep?
Sure. I mean, several of the medications that are used for treating whether it is blood pressure or diabetes or heart disorders can impact sleep. For example, the most common ones are what we call beta blockers that are often used for blood pressure and for heart diseases. It can certainly impact sleep. It can fragment sleep. In some people, it can even lead to nightmares. So all of those are possible. But everything in life is a matter of weighing risk versus benefit. Like if they have significant underlying blood pressure or heart disease for which they need that medication, obviously we need to continue that and then address this in a different way, whether it is going to mean addition of other medications or modifying the dose. Or sometimes, if it's prescribed at night, I might tell them to take that in the morning if it is okay with their cardiologist. So certainly adjustment of medications can be done. Not to forget, when with all this news about COVID, most people are forgetting to address their other chronic medical problems. Either they're not able to see the doctor, and now certainly telemedicine has, helped that significantly. But they need to follow up, because if their blood sugar is not controlled, that itself can affect sleep, because they may wake up several times in the night to use the bathroom. So any of those could also be contributing to lack of sleep. So please talk to your regular doctors, and if sleep is a persistent issue, talk to the specialist to take care of it.
What about snoring? Something which many have, and many, of course, we don't realize it. What should a person do if, someone around them may observe it? And is it important to take some steps or just accept that that's the way it is?
Now, see, previously people used to laugh about snoring and never realized that it was a medical problem. Clearly, now we know that, snoring could be a warning symptom of a problem called obstructive sleep apnea, often referred to as OSA or sleep apnea. So what happens during sleep is, as we get into deeper sleep, our body muscles relax. And when the muscles relax, the muscles around the breathing pipe, or what we call the upper airway, also relax. And therefore, the pipe becomes narrow. So imagine now breathing through a smaller pipe. You will make a noise every time you breathe in or out. And depending on how much the pipe gets narrowed, the noise becomes louder and louder and louder, until one stage where the pipe closes completely and there is no air moving to the lung, and they stop breathing. And then suddenly wake up with a jerk, or when others are observing them, they would say that the snoring gets louder. Sometimes there is no snoring, and I even see them stop breathing. Okay? And the patient themselves, who are usually unaware of their snoring, might say, sometimes I'm aware of my own snoring and I wake up choking. And that's the period when they are having apnea. So when somebody is snoring, it is important to find out, is it just simple snoring or is it sleep apnea? Because whenever we have any obstruction, like when we have a common cold, our breathing is not normal and therefore you may snore, but that's a very temporary thing. Children may snore if they have enlarged tonsils, enlarged adenoids. So that's a different story. But in adults, often when they have snoring, it's important to find out whether this is simple snoring versus sleep apnea. And in sleep apnea, what most people would report is they will say, I have no problem sleeping. I go to bed on time. I wake up on time. But when I wake up, I don't feel fresh. It's often what we call a non-refreshing sleep. They wake up with a headache, or they wake up with irritability. They feel like, throughout the day, they feel fatigued, tired. So when they're sitting at work, they feel like sleeping. Sometimes when they're sitting and watching TV or reading a book, they would doze off. And it can get to a point where even when they have to concentrate, like when they are driving, they may feel sleepy, and it may lead to motor vehicle accidents. And if it is sleep apnea and it remains untreated, it can lead in the long run, it starts affecting the blood vessels, and it can lead to blood pressure, diabetes, heart disease, and stroke.
So how does one diagnose that, somebody has obstructive sleep apnea? What are the diagnostic modalities that you use in sleep medicine?
We do what is called a sleep study. There are, the scientific term for it is a polysomnogram. What it entails is like, there are two different types of sleep studies. One is the full polysomnogram or detailed sleep study that we do in a sleep lab, where, we hook up the EEG wires, then we also monitor their oxygen level, how they are breathing, how is their heart rate, and the EEG helps us to find out what stage of sleep they are in. So it gives a very comprehensive evaluation of how they are sleeping, and during their sleep, Are they snoring? Is it affecting their breathing, their oxygen level, and their heart rate? So this is a comprehensive in-lab polysomnogram. But there's also an option of what is called a portable sleep study or a cardiorespiratory sleep study, which can be done anywhere. It can be done at home, it can be done in any hospital, in a hotel, wherever you are. And that's a much more simplified version of this, where we don't have EEG, so we won't know whether the person is sleeping or is it deep sleep or light sleep, but we can monitor if they are snoring and if the snoring is affecting their breathing and their oxygen level. So if I'm having a clinical suspicion of only sleep apnea, sometimes I may go with just a portable sleep study. But if I have concerns on any other coexisting sleep disorders, then we may want to do a detailed polysomnogram.
And what would be the treatment for this as well? What would you advise apart from sleep hygiene? Are there any other treatments in sleep therapy?
So, if for sleep apnea, let me start with that. For sleep apnea, the treatment is invariably, there are no medications to treat sleep apnea. So it may involve some advice on, weight loss, sleeping on the side, and if they consume a lot of alcohol, taking care of that, addressing any other risk factors like hypothyroidism needs to be treated. That is one part. But if they need further treatment, then it depends on how severe their problem is, whether it is mild, moderate, or severe. And we may advise some what we call oral appliances, which are created by dentists, or we may advise what is called CPAP therapy, continuous positive airway pressure. It's almost like an oxygen mask, but it's a tight mask where it blows pressure and keeps the pipe open, which they may have to use at night, or you may have to have surgical options. So there is no tablets to treat sleep apnea as of today, but there are very efficient methods to treat, and people will feel remarkably different once they are treated, and more importantly, prevent the long-term complications. Now, when it comes to other sleep disorders like insomnia or circadian rhythm disturbances or parasomnias for that matter, there we first, try to identify what could be their risk factors, try to treat that, and also do appropriate counseling on whether it is sleep hygiene measures or any other aspects that need to be addressed. And sometimes we may have to use medications. There are medications available for a lot of these. I would like to reiterate again that any of those medications need to be taken under supervision as advised and followed up, so that it is only given when necessary and appropriately tapered and stopped when it is not necessary.
How does the stress and anxiety actually, especially during this time, how does that affect sleep? Even if the person is maintaining a routine and regular sleep schedules, if one is constantly worrying, how does that impact sleep, and what can we do to prevent it?
See, unless the mind is calm, it disturbs the sleep, which is why, one of the most important reasons why sleep is affected is any kind of psychological factors. It could be happiness, it could be any other emotion. Like, people are sleepless before they get married, for example. People are sleepless when they have a health problem or when they lose a loved one. So any of these stimulates, neurohumoral factors, like in the brain, which can make you more stimulated and make you more anxious and therefore have difficulty sleeping. And the best way to address that, as I said, is number one, talking to people, understanding what you can change, what you can't change, how to accept that. Any of those, sometimes it's amazing how just opening up to a doctor, talking to them and understanding that makes a difference for a lot of people. Doing something that is relaxing. Okay. And when I say relaxation techniques, often people think it has to be meditation. Not necessary. I mean, relaxation can be different for each person. To someone, it could be just playing with their child, which is fine. That is a relaxation technique. Someone, it could be music. And when I say music, again, it may not be generic. They may like a particular form of music that is more soothing or relaxing for them. Some people like to read a book. Any of those kind of relaxation techniques does make a difference. Not to forget, while in bed, we also teach people what is called progressive muscle relaxation. So we basically ask them to, keep their eyes closed, clench their fist as tight as they can and slowly relax it and keep their eyes closed. And that usually allows them to drift to sleep and diverts them from other anxiety that they may have. So there are techniques that you can use to relax and try to initiate sleeping. But if you are in bed and unable to sleep for more than like 45 minutes to an hour, we always recommend get out of bed, do something else, and go back to bed when you're ready to sleep.
Absolutely. How do disturbed dreams play into sleep?
Sorry, I didn't hear you. Sorry.
So, this is about dreams, and sometimes people have disturbing and frightening
Sure.
dreams. Does that affect the sleep at all? Though we might wake up with a pounding heart and feeling very anxious, but has that also impaired sleep?
Sure. Dreams are a normal part of sleep. Okay, most people experience dreams. Okay, and dream research is one of the hardest things to do. Like it's a lot of it relies on what patients relate to, and some people even believe that dreams don't have a color, and we attribute the color to whatever we are seeing in our dream. Having said all of that, like what we should understand is dreams can happen during any stage of sleep. There are 4 stages in our sleep, what we call N1, stage 1, 2, 3, and what we call REM sleep or rapid eye movement sleep. Approximately every 90 minutes to 120 minutes, we go through a REM cycle. But the initial REM cycles are very short, just about 5 to 10 minutes. As we get to the early morning hours, our REM cycles are long, almost about 30 to 45 minutes. Why I'm referring to this is we remember dreams that happen during REM sleep. We do not remember dreams that happen during our non-REM sleep, which is why people wake up in the morning saying, hey, I can completely remember my dream. But then if it was before midnight, they're a little confused. I saw something, but I don't remember it because that probably happened during the non-REM sleep. Now, as I said, dreams are normal, but if there is a pattern or if it is so disturbing that they wake up, feeling, sweaty, breathless and all that and panicking from that, then it could be nightmares, like what we refer to as nightmares. Or it could also be a part of what we call post-traumatic stress disorder. Like when you are going through something, whether it is a war or whether it is COVID or whether it is something else, like if it has bothered you so significantly, those thoughts could haunt you and wake you up. And if dreams are so disturbing, then there are ways to suppress it, whether it is with medications or with counseling or, um, imagery techniques and all of those. But other than that, if it is just dreams and it's not bothering, we just say, please leave it alone. Don't bother about it. It's just normal part of us.
We'll now take some questions that are coming. But before that, I wanted to ask you about the diet. So, how does our food, our eating, influence our sleep? And we also say that there are certain foods which are supposedly good to make you sleep, like we talk about milk or something to do with even berries, tart cherry juice, chamomile tea. These are all lavender. Do they all really work? And is there anything that one must not eat at bedtime, which would probably interfere with the sleep?
Yeah. When it comes to eating, the first thing I would say is it is best to eat at least about 2 to 2.5 hours before your bedtime. So I always tell people try to eat before 8 p.m. latest. And the reason for that is it takes that long for that food to be digested and going past your stomach. Otherwise, there is a high chance of having acid reflux, and that itself can disturb sleep. So eating early, at least 2 hours before bedtime, is important. Avoiding a very heavy meal at night, avoiding spicy food at night, all of these can prevent acid reflux. Like when you go to bed with a full stomach, like certainly it hits on the diaphragm. It can be really harder for people to sleep. So that is the number one thing I would say about diet and sleep. Then, with regards to specific things that may help with sleep, there are food like what you mentioned, milk certainly seems to promote, like tryptophan and serotonin secretion in our brain, which therefore can lead to better sleep. Milk with honey is sometimes proposed. There are also some alternative medicine kind of thing that people mix with milk and try to have. I'm not an expert in that. I should not be commenting, but certainly, like milk with honey, and also, like bananas are rich in tryptophan. That can help. Chamomile tea is thought to help. So if it helps, it's certainly worth trying. It doesn't hurt. Of course, keep in mind other restrictions you may have. Like if you're a diabetic, I certainly don't want you to take milk with honey or bananas. Or if you have kidney disease, you shouldn't be taking bananas. So keep those in mind. Yes, these are often considered, remedial or helpful measures. So it's worth trying, but most importantly, eat early and avoid full stomach and spicy food at night.
So I'll read out the questions which are coming real time on our FB Live. The first one is it possible for, this we have already discussed, possible to develop from temporary to chronic sleep problems, and already said that there is a possibility. The next one is what self-care practices might help, and are these different for different age groups and genders for better sleep?
Yeah, I mean, self-care, I assume we are again talking about sleep hygiene measures, which is what we recommend. Um, Having a schedule for any age group would work, but trust me, post-retirement, elderly people, a lot of the times when they don't have much of activity in the daytime, have a tendency to nap in the afternoon, and therefore their nighttime sleep can be impacted. But having a routine would certainly make a difference. Eating on time, morning sunlight exposure, exercise schedule, particularly in the morning and early evening. And this is where I think for youngsters, it's particularly important to mention that exercise too close to bedtime is not recommended because it may impact sleep in some people. There are a few who say it doesn't affect me, but in general, it is better to avoid exercise too close to bedtime. Avoiding any kind of stimulants, like avoiding coffee, tea after about 5 o'clock. It's okay to have 1 or 2 cups of coffee or tea in a day, but avoiding it after 5 p.m. would certainly help to sleep better. And we talked about eating on time, which again is a huge problem with several people. They all eat late. People working shift work come at 11 p.m. or midnight and eat at that time and then try to, sleep right away. So some of these may have to be individualized, but in general terms, all of these kind of sleep hygiene measures would help us to sleep better.
When should people take professional care for sleep problems? Where can we find experts? Well, we have one expert right here, but when should people? When is it a problem? And that what are the red alerts that now I need to seek professional help? And do they need to go to a sleep specialist, or what would be the first step? Can they go see their family doctor or their general physician? So who should they go and see?
Yeah, I mean, while I would love to say go to a sleep specialist, there aren't enough of us. So it is a new specialty, and therefore there aren't many sleep specialists in the country. So it's certainly absolutely fine to seek medical help with the doctors whom you're comfortable with, the general physician. Um, so I would suggest that if you have a sleep problem for no reason, like if there is a trigger factor, something happened and therefore I'm unable to sleep for a few days, that's okay. But for unknown reasons, you're unable to sleep for 2 weeks or more, it certainly needs a medical attention. That is with regards to not sleeping. If something abnormal is happening during sleep, like you're screaming or talking or walking or eating, any of those, I would say if it's a frequent phenomenon, then please seek attention. When it comes to snoring, as I said, often people who have the problem, people who are snoring never know that they are snoring, and it's the bed partner or somebody else who has observed and told them that they are snoring. If snoring is very loud, if you're waking up with dry mouth, and if you're feeling tired or sleepy in the daytime, if you're feeling excessively sleepy, remember, sleeping all the time is also not good. So if you're sleepy all the time, that's something that's a red alert and really needs medical attention. And not to forget, if your blood pressure or diabetes is not well controlled and you have a history of snoring, remember that it could be due to coexistent sleep apnea.
We spoke about this, but what specific sleep disorders are likely to be exacerbated during the COVID-19 pandemic?
Number one is insomnia. Those who are unable to sleep definitely seem to have a problem, particularly those who already have an underlying anxiety disorder or depression, any of those, they find this very difficult to cope with, and it can be an exacerbation. Number two, people with sleep apnea. Even this morning, I saw someone who said that he's been observed to snore more after the lockdown. And then when I asked him, he said he has gained 15 kilos of weight in the past 1 year, just being at home. So, certainly weight gain is an important risk factor for snoring and sleep apnea. So those kind of things can also be exacerbated. Also, people with prior sleep problems, like sometimes they're unable to get their sleep medications without a prescription. So and whether it is diabetes medications or hypertension, and then they are skipping medications, and that is leading to more problem. So I really would highly recommend, and I know it is getting difficult to meet doctors or get prescriptions, but now with so much of telemedicine options, certainly something to consider. And I'm pretty sure somewhere you will be able to see or get an opinion and take care of these problems.
Okay. Is the behavioral therapy a good option for me now? We don't know what this person is suffering from, but what is behavioral therapy for sleep?
Behavioral therapy, yeah. So this is what I was mentioning about earlier. Saying that there are people who do all the wrong things so that their sleep will not happen. For example, lying down in bed, watching TV, reading book, playing loud music, any of those things that you shouldn't be doing to get a good night's sleep. There are people who continue to smoke till bedtime, use substances that could be stimulants that are causing their delayed sleep. Um, there are so many abnormal behaviors that people have that can be modified. So they either don't realize that it's a problem, or they realize and they have not modified it. So that's what we refer to as behavioral therapy. So it certainly is possible. If there is a lot of insufficient sleep hygiene, we can modify behavior and help them sleep better.
This is what you just said. This person says, I'm gaining my weight while working from home. And will my sleep improve if I lose weight?
Absolutely, yes. In fact, it's well known that when people lose even 5% of their current body weight, even though it may not get them to a normal weight range. For example, somebody is 100 kilos and his BMI is high. If he loses 5 kilos, which is 5%, 95 kilos may not be normal for that person, but they will still start seeing a lot of improvement in some of the sleep issues, particularly snoring.
With the shift work being so common, is 8 hours of sleep during the day likely to benefit in the same way as sleeping for 8 hours during the night?
See, shift work is not a new thing in our culture to human beings, because as doctors, we have done night duties, nurses do night duties all the time. So shift work is not something uncommon. However, the way the shift work has become different after the BPOs have come into place, the IT professionals have started doing this, they do a fixed late shift all the time. Like they continue to do, start in the afternoon, go past midnight, or they start at night and work till morning, depending on whether they are working for the United States hours or the European hours or the Australian hours. So it is completely changed because they're working at a particular time, which their body, their internal clock is telling them to sleep, but they have to continue working. And there are a lot of external cues at that time that are telling them to sleep. For example, the room might be, outside might be dark, but they're sitting in front of a computer and trying to work. So some people are able to cope with it, some people cannot. And as I told you, this is a mismatch of the internal clock and the external clock. So it's almost like a chronic jet lag that people start developing. Sleeping in the daytime may never be as good as sleeping in the nighttime, because there are a lot of circadian hormonal changes that happen. So people with shift work develop hormonal issues. I mean, we see women with irregular menstrual cycle relating to shift work. It can happen. Men or anyone gaining weight because of changes in the hormones that happen. They're often sleep deprived because during the daytime, when they are trying to sleep, the rest of the world is awake and they start they continue to get phone calls and stuff, and they are neither sleeping nor are they awake. So I always tell people that if you have to sleep during the daytime, assume that is your night. Turn off all your phones, like don't wake up to eat just because somebody else is eating lunch. Pull all the curtains out so that, like you make the room as dark as possible and make the room as conducive to sleep as possible to start sleeping. So there are aspects that we can advise them, but a daytime sleep may never be as good. But if it's a job and you have to do it, you have to learn to cope with it. Some people can and some people cannot.
What can be the reason behind the insomnia all of a sudden in teenagers?
It's a combination factor. Number one, there's a lot of peer pressure on their educational aspects. During my school days, I probably just went to school and came back and I studied myself. Today they start classes at 4 a.m. or 5 a.m. preparing for whatever professional colleges they want to join. And it's getting earlier and earlier. It used to be 11th grade, then became 9th grade. Now from 6th grade, they start doing all these, competitive exam preparation. So there's a lot of peer pressure. There's a lot of, extended time that is required from children, which certainly seems to be affecting their sleep. Number two, considering all of this, they often do not have engagement in other recreational activities, whether it is sports or whether it is, any other recreational activities. I don't think they're getting adequately involved. So constantly their mind is with something that they'll have to compete with, cope well with. Certainly that seems to also have an impact. Not to forget screen time, social media. Like there are children who come to me saying that they are so used to, like every couple of hours they have to get up and check their messages or check the number of likes they've got or, whatever. And there is a cyber addiction component and a screen time use component that certainly seems to affect the sleep of youngsters and teenagers.
A related question, my daughter is 13.5 years of age, has not been able to sleep for the past 5 days. I've already visited her pediatrician. He couldn't pinpoint anything specific that could cause her sleeplessness. Her sleeping patterns have been disturbed due to various medical issues that have been addressed, but now suddenly she's lost all her sleep and it is a cause of concern.
Sorry, what did you say the child's age was? That's one time
13.5.
13 and a half. So it's a teenager.
Yeah, with some medical issues, but currently a sudden spurt in insomnia for the next 5 days.
Honestly, this is a very individual based question, which I cannot give a general answer because I need to understand what the medical problems are, what medication the child is taking, what happened 5 days back that made the child lose sleep. So really, I think the child needs a consultation if the family is concerned that it's getting worse.
My father is a diabetic under control, has mild vertigo and Parkinson's, and he has some hearing loss. He's been facing disturbed sleep since a year, but not every day. How to counter this?
Yeah. So, he's got several medical problems that could be affecting the sleep as well. Hopefully his diabetes is under control. Hopefully the Parkinson's is under control, because Parkinson's itself can lead to sleep disturbances. Sometimes patients with diabetes, patients with neurological problem have what is called restless leg syndrome, where they feel like there is some creepy crawly feeling in their leg. They feel like getting up and walking, and that can also impact the sleep. So I think you need to address on number one, the underlying medical problems, the medications that are being given for the underlying problems, and see if anything additional needs to be done. Once again, a very individual based question that needs specific attention.
Just two more questions will be close. One is about taking melatonin every day. Will that help?
Melatonin will help for specific patients, not for everyone. In the lockdown sleep syndrome, particularly people who have no prior medical problems, no other issues, and are not having enough sunlight and inadequate activity, we are using melatonin, and it seems to help a lot of people. Melatonin has also been studied in people who are having jet lag, and it seems to help in that group as well. In the elderly, sometimes it's a very safe medication to use because we are always cautious about using too much sedation in very elderly people, because the last thing you want is for them to feel drowsy and have a fall and have a hip fracture. So we need to be cautious. And so we use melatonin in those people, and also in those who are working shifts who are having trouble sleeping. So specific aspects under the supervision of a doctor, it's better. I know it's available over the counter, but certainly not something to be taken every day.
Right. The last question is about palpitations during sleep. Is it common and is it linked to any particular disorder?
If someone has palpitations, number one, we'll have to monitor whether it is due to any kind of heart rhythm problem. Are they getting what we call arrhythmias or rhythm problem at night? Or is it related to any other medical problem like, high levels of thyroid can lead to palpitations, any of those. Or if they are a diabetic and, their sugar is low, they can develop palpitations, they can develop dizziness. So you first have to identify whether there's any medical reason for the palpitation. Okay? If those are all excluded, and one more thing that can lead to it is acid reflux. People can have dry cough, they can have palpitation, they can feel breathless, any of those. So if these medical problems are ruled out, sometimes it may be related to nocturnal panic disorder. People wake up, as we were talking earlier, with nightmares, bad dreams, palpitations, sweating, then it needs to be addressed. It sounded like an anxiety or a panic attack at night.
Doctor, thank you so much for taking all this time to explain to our viewers about sleep and sleep disorders. Such an important topic, but mostly people sometimes do not give that much importance to sleep as they do to other symptoms. So I'm sure with this, we have all learned a lot about how to maintain sleep hygiene. And viewers, if you have any more queries, you can put it on the comment section and we'll get back to you, or send us a message on the inbox in our Facebook Messenger. Thank you, viewers. And tomorrow we are meeting same time. We're going to talk about bouncing back to fitness post-COVID-19 infection. This is going to be a discussion with Dr. Richa Sharma. And we are going to talk about what kind of fitness measures can be taken both to prevent during pandemic times or when you're stuck at home, and also if you do get COVID-19, and how to bounce back in the post-COVID period, how to gradually build up and get back to your health and fitness. So meanwhile, don't forget our mantra, which is SMS, which is social distance, wear a mask and sanitize, and do get vaccinated when your turn comes. Until tomorrow, goodbye, stay safe, stay healthy. Thank you, Dr. Ramakrishnan, and namaste.
Thank you.